Cancer is a fight, but it's more of a mental fight. It's those days when you come home from these treatments and you stare at a blank television screen and you think to yourself, am I going to be able to walk my daughter down the aisle? Am I going to see my son graduate? Am I going to, those kinds of things. Will I see my grandchildren? Those kinds of things. That's the impact. That's the impact that cancer has. I was trying to get in shape and it wasn't going so well because I had that hip pain. So I went to Geisinger and they ran me through a battery of tests. I had a bone scan, a CAT scan, MRI. We did the biopsy and I knew for sure.
Multiple myeloma is a blood cancer. 20, 30 years ago, it was considered, incurable. It was considered, death sentence. And now it's like a chronic disease where we have lots of treatment options for patients. Typically, we're looking at chemotherapy as an option for treatment, stem cell transplant. We give patients injections to stimulate circulation of their stem cells, so stem cells which would typically be in the bone marrow. We give medication to circulate them through their peripheral system, and then we have a machine that's gonna collect those stem cells and we freeze them. And then what we do is set up a transplant date, so patients will be coming back in, they'll get high-dose chemotherapy, and then the next day we give him back his stem cells. We thaw them out and we infuse them back in.
Jamie was with me and I knew that they're not gonna let me fall. They're not gonna let that happen to me. The nurses, they're truly the best people on the planet. I'm only here because their care and their kindness and the kindness of my family and friends.
He's really a testament to living well with cancer. He's taken what could be a horrible, emotionally debilitating situation, and he's started traveling. He started this survivorship journey to help other cancer patients, but not just the cancer patients, but, caregivers.
Surviving cancer is not a one-time event. Survivorship lasts a lifetime, and that's why we need each other. But my first guest tonight, you're gonna really love. I then started a nonprofit and started my official advocacy. We are going to share our experiences, and I'm finding more and more people that absolutely want to share the experience. They absolutely want to tell their story. I've got a lot to do, but it's so much more hopeful now because I know that these people are going to take care of me.
We've just been monitoring his labs, making sure there's no signs of reoccurrence. If John ever needs anything, he just sends a message, and if he's having some aches and pains, we'll set up an x-ray, and we take care of him.
Geisinger saved my life, and they helped me. And more importantly, they did it in the kindest way I could think of.